The eggs are room temperature, which is good.
Janelle Camacho and her 89-year-old grandmother, Deloris Wolfe, are baking pies.
We're going to make the lemon sponge pie today.
Grandma rolls the pie crust, makes the pie crust. I do the filling, so we work together.
While the ingredients may be secret, the mission is not.
It's something that my grandmother and I started doing probably 10 plus years ago, I think, and we raised money for multiple sclerosis. Our first order was probably over 100 pies that we did in my house with 2 ovens in 2 days.
They sell homemade pies to raise money for the annual walk MS.
I want to do all I can to have money going to research. And my goal each year is to earn $15,000.
And there's a reason why Janelle and Deloris are so passionate about this organization.
When I was around 8 years old, my mom was diagnosed with multiple sclerosis. It was a pretty crazy time because at that time, no one really knew what multiple sclerosis was.
So multiple sclerosis is MS, and it's actually an autoimmune condition. So it's your immune system that is confused, and instead of attacking bacteria and viruses, it attacks your brain. It attacks the myelin in your brain. And the brain and the spine control everything in your body, so MS patients can have almost any symptom.
I went from a mom that used to do all the cooking and cleaning and get us up for school and make our breakfast to that wasn't happening, especially when she was having a really bad day.
It was a hard time, and the children were at an age where it was so hard for them.
Actually, her mother had MS at a time when there were no treatments, and then we were still learning about treatments, and we really didn't know about lifestyle things. So her mother really struggled.
Janelle's mother lived with MS for 30 plus years. During that time, Janelle got married, had 3 children, and was doing well until one day.
I was 31, and one morning I just woke up and my whole left arm, my left breast, and all the way down my back was completely numb. And didn't know why.
Janelle turned to her family doctor for answers.
He said, hey, maybe it is pinched nerve. Let's get some tests and figure out what it is. The doctor called on a Saturday morning. And I think when doctors call on a Saturday morning, it's never good news. I was sitting on my side of my bed and he said, I think you might have MS from your MRI. And I was like, what? Like I literally almost fell off my bed because I just thought this can't be happening.
More tests confirmed Janelle had MS.
Replayed everything that happened to my mom when she was diagnosed and how much time she spent in the hospital and how crazy it was for us as kids. And my kids were even younger than I was when my mom was diagnosed, so they completely won't understand what's going on.
I think she called me before she called her mother. I think she called me when she got the phone call from the doctor. And I thought, this can't be.
We got on her treatment regimen early. We incorporated strong medications and lifestyle changes, and she's done amazing. And she's learned that MS today in the 2000s is much different than it was in the 80s and 90s. And you can sort of live a full, healthy lifestyle with MS.
I'm actually on my 3rd medication now. They've come out with oral medicine that I now take a pill instead of injections, which is a blessing. I've been on that 5+ years now.
Oh, I think she's doing great. I often say, I don't know how she keeps up with the things that she does and is able to keep going.
I feel good. I'm doing well, I'm working full time, I'm taking my medicine daily, so I'm doing good.
Medications that are changing the face of MS. So now Janelle and Deloris use their energy to help others.
Grandma alone has raised over $300 and some thousand. Me probably over $10,000 over the many years that we've been walking.
I feel that maybe in some small way I've helped them to learn about one special medicine anyhow. So I want to do all I can so that they finally find a cure.